as a parent, what are the things that we should be looking for to kind of warn us that our patients our kids may demonstrate traits? Because I know that ADHD is genetic. Like if I have it, there is way more likely that my kids are going to have it. Like, what are the
Yes.
things I should look for?
That's a good question. What should a parent look for? And it's pretty age dependent. With little kids, it's exactly what you said. That 5-year-old story, that's exactly what a parent should look for, which is the kid can't sit still. And, you know, there you're doing things, but you're also paying attention. And that is classic ADHD. I also daydreaming.
Mm.
So in girls, especially, a lot of times they don't have the H component, they don't have the hyperactivity component, and they never get diagnosed. But then when you talk to them and you say, do the teachers ever ask you or tell you, oh, she's always sitting in the back daydreaming? And the parents go, yeah, yeah, she's always daydreaming. And they're so frustrated with the child. And I go, well, that's the attention deficit. They're not paying attention. So that's one of the things, daydreaming. The other thing is not sitting still. I had this kid in my office. He was so cute. He just could not, like, he was literally crawling on my furniture. And at some point, he was standing on the armrest of my chair above me. And,
Oh,
you don't
wow.
need any tests to tell you this
That he's
kid
got
has
ADHD.
ADHD.
Yeah.
So parents, the challenge for the parents is however your child is acting is normal to you, right? You are trained to see your child exactly the way they are. So you don't see that this child that cannot, sit still and is climbing all the furniture is clearly ADHD. But you should really be attuned to that. And teachers will tell you. What did your mom say? Teachers always told her you had ADHD.
Yeah.
So teachers will tell you. Again, the kids who that fly under the radar are the kids who are actually inattentive. The daydreamers, they don't get caught because, and fortunately, societies are changing, but um, we still expect, well, hopefully not, but society still expects girls to be good girls.
Mhm.
And the daydreamers kind of learn how to fly under the radar and not be detected. And they get missed a lot of times. And by the time they end up on my couch as teenagers, the primary symptom that I see is depression, actually.
Oh,
Yeah.
that scares me a little bit. Is that part, because I think I mean, like you, I got daughters, and so I just kind of, I really really worry about that in them.
So my advice to you as a parent is stop worrying. How old are they?
12 and 10.
12 and 10. Does worrying ever change anything? Does
No.
it ever help? Yeah. So when you're worried, just remind yourself, I'm attuned to my children. I spend time with my children. I'm present with my children. And if there's a need for help, I'll know it. The biggest advice I give is don't wait to get help. It's amazing to me when your child falls and they scrape their knee and they're bleeding, you take them to the doctor.
Mhm.
But a lot of times when kids are starting to socially isolate, which is always a red flag, or they become super irritable, all of a sudden they're having fights, all of a sudden their friends don't want to talk to them anymore. Parents are like, "Oh yeah, my kid's going through a phase." And I say, "It's not a phase. It's a red flag. You got to get your child help. Just like you got help for that scraped knee, you got to get help for the change in behavior. Any sudden change in behavior, red flag. Any isolation, red flag. Irritability is normal in teens. You're 10 and 12 children. Uh,
Yeah.
brace yourself."